Welcome to Bad to the Bones, the podcast where we discuss everything related to orthopedics, joint health, and living an active lifestyle. Welcome back to Bad to the Bones. I'm your host, Debbie Rody. Today's episode is one I think a lot of patients are curious about, robotic-assisted joint replacement. You may have heard the term, but what does it actually mean? How does it work? And how do surgeons and technology come together to improve outcomes? Joining me today is Dr. Mohamed Albana, orthopedic surgeon specializing in robotic hip and knee replacement at Premier Orthopedic Associates. And we also have Troy Jordan from Stryker, a global leader in medical technology and the company behind Mako, the robotic joint replacement procedures. Together, they're going to take us behind the scenes from planning to surgery and patient experience and outcomes. Welcome to the show, Dr. Albana and Troy.
Thank you very much.
It's nice to have you. We're going to dive into a lot of different topics today to give our listeners that very much behind the scenes of how the two of you come together, what it's like in the operating room, and all the pre-planning and how we get these beautiful outcomes. So let's get into it. Let's start with robotic surgery. Dr. Albana, I'd like to, if you can share with our listeners, when a patient hears robotic joint replacement, I think they often think there's no human being behind this. It's just a robot. Can you just reframe that? And from your perspective, what is robotic joint replacement?
Yeah, that's a great question. And I've definitely had that conversation with many patients where we talk about surgery and how I pretty much do all of my joints, both hips and knees, with robotic assistance. And they're kind of taken aback for a second and they're like, wait, are you in the room doing the surgery?
Yeah.
And that's kind of the initial exposure that they have to robotics.
Yeah.
The way to think about it is the robotic side of things, whether it's the Mako or any other robotic platform, it's providing you with a lot of information. Mm-hmm. Each of the different platforms then provides a different way of assistance within the surgery. And we'll get into that more.
Yeah.
But the general gist of it is it gives you a lot more information
mm-hmm.
from a surgical planning perspective.
Yeah.
But it can't do the surgery on its own.
Yeah. So, I mean, like, are you actually holding things, like arms of a robot to do the surgery?
Yeah. So
Okay.
there is an arm that articulates at multiple joints.
Okay.
And after we input the appropriate information, it knows where the body part is, whether it's in your hip, in space.
Troy, if I were to ask you about the Mako system and, the benefits that it brings to our surgeons, what kind of insight could you give us on that?
Mako is an extension of the surgeon.
Mm-hmm.
So it provides the opportunity for the surgeon to do the procedure consistency and reproducible and precise.
Okay, perfect. And if we talk about robotic joint replacement and how that conversation comes into play with the patient, Dr. Albana, at what point in the patient journey does that conversation come up versus just doing traditional joint replacement?
That's a good question. I pretty much only do robotics unless I'm doing a major reconstruction of some sort where someone already has a knee replacement in or a hip replacement in there, and I'm doing a redo essentially of that surgery.
Okay.
So when I'm talking to patients about surgery, we've already done all the conservative measures. They failed the conservative measures, and we're moving on to sign them up for surgery.
Yeah.
At that point, I discuss risks and benefits.
Okay.
And I always tell them I do this with robotic assistance because the first step to the Mako robot in this case, and some of the other platforms as well,
mm-hmm.
is a patient needs to get a CAT scan. And you don't need that for the traditional instrumentation. So it is an extra imaging step that patients need to go through.
Okay.
But it gives us more information to plan the surgery.
Yeah.
So it comes up almost immediately when we're talking about moving forward for hip or knee arthritis.
Is robotic surgery more typically used for like arthritis, or is there like a particular condition, or is there a particular condition, that's really what I want to ask, that the robotic surgery is more used for?
That's a good question. Robotics has expanded quite significantly.
Okay.
From an orthopedic perspective, there are other uses other than hip and knee. They have platforms for the spine and the shoulder as well, but
Okay.
for all intents and purposes, as a lower extremity surgeon, the amount that the Mako robot has progressed has been profound. And
Interesting.
we finally got the new robot at our hospital system, so very
Okay.
excited to
Nice.
bring that on. Yeah.
And you've recently celebrated, what was it, 1,500 procedures? How many procedures?
Yeah, I think it was something like that.
Was it?
if I'm
I
not
know it was
mistaken.
over 1,000.
Yeah.
I have pictures of it. I can confirm that. So where did you gain this level of expertise in this decision-making process to do robotics versus traditional? That's a good question too.
That is a good question, because when you look at the literature of robotics versus traditional instrumentation,
Yeah.
the long-term outcomes, they're pretty much the same
Yeah.
for now.
Okay.
And I put that asterisk for a reason. But the information that you gain as a surgeon is significant from a planning perspective before we even get into the operating room,
Yeah.
to the micro changes and adjustments that can be made based on the mapping that I do during the surgery itself.
Yeah.
So in fellowship training, I had exposure to, of course, the traditional instrumentation.
Mm-hmm.
But I also had exposure to pretty much every single robot that's out there.
Okay.
I do think the Mako personally is the best in that it provides the most accurate information.
Yeah.
I don't have any conflicts of interest. This is just
Yeah.
my personal
Yeah.
thought. From my perspective, if you were going to go to a gas station or a mechanic and you had, for example, a flat tire,
Mm-hmm.
you could pump up the tire and then get a pressure gauge and check the pressure and
Yeah.
make small adjustments until you get where you want to get. Or
Right.
you could get one of those compressors that has the pressure on it.
Yeah.
It's less steps. You're more accurate. You know exactly how much
That's a good analogy.
adjustments you have to make. Same thing with this,
Okay.
except this is on a human, right? So I'd rather know if I can make the adjustment of 1 degree to a cup going into a total hip replacement or in the positioning of a total knee replacement. I want to know for sure I put in 1 degree of rotation
Yeah.
versus let me just eyeball it and see where exactly my cut is going.
Yeah.
So that's why I like robotics so much. It's
Okay.
for that extra information.
So your decision making to use robotics has just come from your experience and learning how precise it is. Would that
Exactly.
be a good way to summarize that?
Exactly.
And Troy, what kind of goes on behind the scenes for you when Dr. Albana contacts you and says, I have a case coming up? How does that bring you into the picture?
We start with getting the patient information, and then we'll process a CT scan.
Mm-hmm.
And once we receive that and it's accurate, we will then make a plan,
Okay.
and then we'll take that plan and provide it to the surgeon beforehand,
Mm-hmm.
and then we'll evaluate it together. Within that same plan, we can also determine what kind of implants we need,
Yeah.
if we need additional types of implants, because sometimes we can have it can be a difficult procedure or not a difficult procedure.
Yeah. Is there an actual conversation that takes place between the two of you to both be on the same page that this is a good procedure for this patient?
Yes,
Yeah.
we actually have the conversation frequently. We also have other team members that are Mako product specialists that are there. They can also provide insight
Okay.
on that. And yes, we do have conversations pretty much every case, because every patient is different.
Yeah.
And every hip is different
Yeah.
due to their arthritis or
Whatever the condition is.
Mhm.
Yeah, absolutely. Well, if we get into a little bit more of the planning and preparation, one thing I think that from my perspective that I don't know, patients may not really realize is how much goes on before the actual surgery. So, Dr. Albana, can you walk us through what that planning process looks like actually before you get into the operating room? Like, you mentioned mapping. Am I correct in that the robot actually doesn't allow you to cut beyond the mapping or the plan, so to speak?
Yeah, to a degree. Before we get to that, so as soon as the patient is signed up for surgery and they get their CAT scan done, that the CAT scan goes to the Mako team that creates a template of what the bone looks like based on
Okay.
imaging alone.
Yeah.
Like Troy was saying, if something looks crazy or out of whack, the Mako team, Troy and John, one of our Mako specialists, they call me and they're like, hey, you want to look at this like sooner rather than later, see if you want any extra implants or anything, for us to ship in that we may not carry on the shelf.
Okay.
So that's step number one of the information that we wouldn't normally get with just traditional
Yeah.
hip replacements or knee replacements. And the reason that you don't always know what you need is CAT scan is a type of imaging that looks at bone in very fine detail.
Yeah.
It's not standard for a knee replacement unless you're using robotic assistance.
Okay.
So if you know you're missing bone, then I want to make sure that I have everything I need to rebuild that joint. So that's step number one. Then once we get into the surgery itself and I expose the joint, I put the array, which we didn't really talk about, but basically it's an extra set of pins that go into either the pelvis or the knee that attaches an infrared kind of camera that communicates with a robot to tell the robot where the patient is in space.
Yeah.
Once that array goes in, I map out the anatomy using a special probe. So now, using what I mapped out, plus the CAT scan from the Mako, we generate this three-dimensional image of the patient's knee on the computer.
Okay.
I get to put the replacement
Wow.
on that image
Yeah.
before I put it into the patient.
That's cool.
So everything down to the implant size and position is established before we even start cutting bone.
Wow.
Now,
That's really cool.
to answer the question specifically, can you only cut within a certain area? Yes, you can, but the robot only knows where the bone is.
Okay.
So as the surgeon, it's my responsibility to protect all the soft tissues,
Yeah.
make sure all the things that the robot can't see is out of the way.
Yeah.
And the robot can't move, can't cut, can't do anything without me controlling it.
Yeah. Very cool. So, Troy, I was going to ask you, what does Stryker do in the background prior to surgery? But Dr. Albana answered a lot of that. Is there anything that you want to add that, that you're doing on the technology side behind the scenes to prepare for the surgery?
Yeah. So what we do is we take care of the implants, and we also take care of the robot itself.
Mm-hmm.
We calibrate it, make sure it's running correctly. We're there to troubleshoot any issues so the surgeon can focus on the procedure of the patient and not worry about what's going on the rest of the room per se. So it tries to narrow down the focus.
So that's the day of surgery that you're doing that, or is prior?
That's prior before surgery.
Yeah.
Yeah, we do that before the patient comes into the room.
Okay, yeah.
And then while the patient's in the room, we're still there,
Yeah.
making sure everything's going smoothly.
Okay. Dr. Albana, what are some of the non-negotiables for this type of procedure that you need to have in place to make this run smoothly?
Well, I think the non-negotiables are more related to the joint replacement itself than the robotics.
Yeah.
Everything comes down to patient optimization.
Yeah.
And being on the same page as a patient from a decision-making perspective, right?
Mm-hmm.
Patients who are motivated, who are optimized for surgery, and who feel like they're part of the decision to move forward with surgery, they tend to do better.
Yeah.
I think that's number one. The surgery itself having robotic assistance, I don't know necessarily that there is a negotiable versus non-negotiable. A lot of people do traditional hip and knee replacements. The Mako or robotic-assisted total knees are far more common.
Yeah.
A very small percentage of surgeons actually use robotics for hip replacements.
Okay.
I don't understand why, but
Okay, then I won't ask.
a small percentage do.
Okay.
It's a lot of information. I don't understand why you would give that up.
Okay.
But it can be successfully done either way.
Yeah. Okay. And Troy, what is your role in the operating room during the procedure? Is there anything, are you just kind of standing behind the scenes, just overviewing, what are you actually doing in the operating room
I'm
during the procedure?
I'm assisting the rest of the room, helping run the robot.
Making sure the music's good.
The music's good.
Yeah.
Helping the scrub nurses that are in the room, assisting anywhere I can be used.
Okay.
And a lot of times it's a team effort.
Yeah.
So sometimes we pull people off the bench and they step in, but the players are always there.
Yeah.
So that's the surgeon. They're always focused. And with Mako, it takes some of the pressure off the surgeon, because now you have a plan and a system in place that
Yeah.
is very accurate.
Yeah.
And I think it when you look at a traditional knee versus a like a Mako knee,
Yeah.
it's smooth. We don't have any surprises, I guess you would say.
Okay. What are there, Dr. Albana, if there are surprises, there's a last minute real time change in the procedure, that you're doing at the moment, how does that impact how the procedure goes with the robot? I mean,
Yeah, that's a great question. It's not common.
Okay.
You're going in with a ton of information.
Yeah.
So to be surprised is rare, but it does happen.
Yeah.
And it oftentimes happens when a patient has really soft bone. And I'm like, Troy, we got to get the stems,
Yeah.
make sure we have everything available. So he's running out and grabbing other implants, but that's
Okay.
something that you can't necessarily plan for.
Yeah.
Once you cut the bone, if it feels soft, you need to pivot and make sure that you have the appropriate prosthesis going in.
Because I obviously don't know how quickly the body changes versus how far in advance the operation was scheduled, and maybe it's 6 weeks out from when that CAT scan was done. What kind of changes can take place with someone's bone during 6 weeks? I don't know. Does that ever happen? Is that possible?
Not so much. We could have the CAT scan done a couple of months in advance.
Oh.
Unless there's, God forbid, a trauma, the patient
Yeah.
falls or something happens
Yeah.
that would result in a sudden change, there isn't really surprises on that front.
Okay. That's good to know. Definitely good to know. So let's talk about some benefits and outcomes and, that a patient's going to experience with robotic surgery versus traditional. After hearing how many benefits the Mako brings to the table, what do you feel about the precision of this system that you translate to your patients that really makes them feel comfortable? Like, you know what, this is going to be great. I'm going to have a great outcome.
Yeah, I think there's two things to kind of consider here. The first is the benefits from a surgeon's side of things, right? As a surgeon, you want to be very precise. You want to be prepared. You want to have plans A, B, and C going into surgery. And you can do that when you have robotic assistance, right? Then there's the patient outcomes. How does robotics address patient outcomes?
Yeah.
And what we know and is very well documented in our literature is the long-term outcomes really are not that much different as it stands right now.
Yeah.
We can put the prosthesis in very accurately, and that's been well documented in our literature in both hip and knee. We're significantly more precise in positioning the components. But from a long-term outcome perspective for patients, there hasn't been a clear determination that robotics outperforms traditional.
Okay.
There are some articles out there published within the last 5 to 7 years that shows there's lower risk of dislocation with hips that are done through a posterior approach with Mako. That's a very specific group that you're picking and studying. there are some studies out there that show robotic assistance in knee replacements has less surgical dissection, less pain postoperatively. But when you look at patients overall as a whole, you
Yeah.
can't generalize that. So I think there's still more research to be done on that front, but it looks like it's trending in a positive direction.
How about the material that's actually used for the implant? Is the material different for robotic surgery than you would use for traditional?
It is exactly the same. However, the caveat is when you use a robot, you don't need to put cutting jigs on, which, it's kind of hard to explain to someone who isn't in the operating room. But when you have a cutting jig, you're putting a saw through a confined space that has metal. And so you will create metal particles that you can't necessarily see or clear out. When you use a robot, of course, with all the information that we're inputting, we don't need a cutting jig, and we could still create these perfect cuts to then put on the prosthesis. So you're at least getting rid of that.
Yeah, that's huge.
Yeah.
I mean, I would think that's something I want to know as a patient. That's really huge takeaway. Interesting. Troy, if you think about all of the, you've seen this process done over and over again, many, many times. What do you think is the one consistent outcome that the Mako offers that really stands out for you?
Consistency.
Yeah.
It's accurate.
Yeah.
It's reliable. It's precise. And when a surgeon is doing the procedure, they're confident that that's what they're going. When they plan and put it up on their screen beforehand,
Yeah.
that's what you're going to get.
Yeah.
And that's what surgeons look for.
This is for either of you, do you ever find that some of the patients are concerned about the material of the implant or longevity of it?
There's definitely been this new, I don't know that it's new per se, but there's been an interest recently in the different types of implants that are used. It particularly comes to light when patients have a reaction to like nickel. Say, oh, I had these earrings or ring or bracelet that caused a terrible reaction. Is this going to cause that reaction?
Yeah.
Most of the implants that we use are titanium or cobalt chromium, and to some degree there is nickel within those.
Okay.
And if I'm very concerned, I'll send the patient to an allergist. They'll do patch testing. They'll put a piece of nickel or cobalt or titanium or whatever it is on the skin. They keep it on for several days. They see how a patient responds. There's been some companies have had this for a while, and it's now expanding to other companies that have completely nickel-free knee replacements.
Yeah.
I think if I'm not mistaken, the hip replacements are pretty much full titanium at this point.
Yeah.
Which is minuscule amounts of nickel.
Well, because what I find to be interesting and maybe even concerning is, oftentimes people will ask, are you allergic to anything? When you're at the doctor's, I'm like, no, but I don't know. Maybe if you expose me to something I've never been exposed to, maybe I'm allergic to it. So how do you know that a patient, maybe they've never been exposed to that product before. It's not just send every patient for testing of this product for an allergen testing.
No, I think that would be definitely overkill. Because even within the joint community, the fellowship trained joint surgeons, there is a pretty stark divide between those who believe that these allergies are real, and those who believe that it's not real when it comes to the replacements. And what I mean is a patient having a response to this? There's a study out of one of the major hospitals out in the Midwest that looked at patients who have these nickel allergies, and those patients had a nickel-free knee implanted. But what they found was there was still nickel particles in the knee because of the saw going through the cutting jigs. And the patients didn't have a reaction to that.
Interesting.
So do they actually have a nickel allergy or not?
Right.
So that's where this divide comes in.
Yeah.
And so I don't go chasing it, and I haven't had any patients that have had an issue even those who have documented nickel allergies, they haven't had issues with these.
Okay, that's good. That's good to know. Well, let's roll right into a patient success story then, because you haven't had any issues. What does a patient success story look like to you after this procedure? I mean, what can someone expect? Full mobility? I mean, is all this talked about before the surgery, I'm assuming? Share with us, a patient that has come back and is just like overjoyed.
Luckily, most patients are overjoyed.
Yeah.
I think, there's two categories, right? There's the hip replacements and then there's the knee replacements.
Yeah.
By and large, hip replacement patients, they have an easier recovery and they tend to be happier quicker,
Yeah.
right? It's an easier recovery,
Yeah.
less pain.
Yeah.
With respect to knee replacements, the literature shows 1 in 5 patients will have some complaint about their knee.
Okay.
I think that number is dropping
Yeah.
because of robotics, but that's the historical value.
Okay.
A complaint doesn't necessarily mean that it hurts or it's bothering them. It could just be it clicks. They don't like that it clicks. Well, it's metal on plastic, so it may click.
Yeah.
Again, with robotics, you're tensioning the soft tissues in a way that you're trying to maintain what the patient has
The
naturally.
integrity of, yeah.
So you should have less clicking.
Yeah.
And that's an anecdotal statement. From a patient success story, my goal is that the patient doesn't feel like they had a hip or a knee replacement.
Nice.
But I can tell you what gives me peace of mind is there's this one patient that comes to mind. She was a young lady who had a connective tissue disorder and she developed hip arthritis very early. I did a robotic-assisted total hip replacement. And so I knew the values going into the surgery.
Yeah.
I knew the values that I put everything in during the surgery,
Yeah.
and I have access to them after the surgery. Well, because of her connective tissue disorder, she dislocated her hip post-operatively. We reduced the hip, and I went back and reviewed all of her information, and I was like, I'm actually very satisfied where everything is.
Yeah.
I don't think that I put the cup in a position that would risk her dislocating. I'm not, questioning myself looking at the x-rays because her whole pelvis is rotated and
Yeah.
I'm getting this altered view. I know exactly where this cup is. So she didn't need another surgery and we managed it non-operatively.
Okay.
And she's doing very well.
Well, let's talk about the knee for a second. Is there a difference in the healing process? Like, I mean, does someone experience less swelling or less recovery time in general using robotic assisted?
Yeah, so I did allude to this earlier that there are some studies, and I want to be very
Yeah,
specific
no,
that this is
yeah.
not across the board, but
Yeah.
there are some studies that show robotics results in less pain and quicker recovery in the short term.
Yeah.
The thought process is when you're doing robotic surgery, you don't need as much of an exposure of the whole entire joint.
Yeah.
Right? I just need to see just enough.
Mm-hmm.
I don't have to peel off all of the soft tissues around the whole entire knee to see what I'm doing.
Yeah.
I could take off minimal soft tissue, cut minimal bone, and replace everything that I'm cutting with the metal that's going in. So there is definitely literature out there to show quicker recovery with less pain medications needed.
That's good to know. And so we've talked about the benefits of recovery. And is there anything that stands out for you about the technology that you want to tell our listeners about? Like if it's maybe been suggested to a listener or a patient to have robotic surgery, what would be the one thing about the technology that you really pride yourself in being able to give to a patient, offer that?
This is something that I would think about in general terms, right? There's a lot of AI out there,
Yeah.
right? Whether it's Grok or ChatGPT or Gemini or whatever, these things are growing rapidly.
Yeah.
Same thing with these robots that are assisting us.
Yeah.
We've had them for well over a decade at this point with thousands and thousands of surgeries that have been done.
Mm-hmm.
It's a lot of information that we gain. And with each update that comes out,
Yeah.
there's more power that we have as the surgeon to hopefully allow for a better outcome
Yeah.
intraoperatively. So just think about where we're going as a society from an AI and robot perspective, and
Right.
think about how you would want things done with robotic assistance and with information, or with the traditional instrumentation.
Yeah.
That's how I would think about it.
Yeah. I mean, for me, sometimes I think I'd rather have a robot, and the AI figure things out versus a human, because we're so distracted with other things in our mind and we might miss something. I don't know. I mean, I'm not taking away from the skill of a surgeon, because I'm just saying in general, I love that combination of your skill and expertise combined with the technology. I
Yeah.
mean, that's a win-win.
And I do want to just make a point that I don't want to detract from anyone who doesn't use robotics. 'Cause
Yeah.
God forbid something happens where the robot loses power, or
Yeah.
something is
Yeah.
off, or you can abort the robot and just go on with a regular
Yeah.
total knee
And that's the
replacement.
beauty of your skill, is that, if that happens, you can abort mission and
Yeah,
just pick up the traditional way.
exactly.
Yeah, that's great. Is there anything that you feel you want to touch on before we start to close out here? Is there anything in, Troy, that you feel is important to talk about for the Mako, in how you collaborate with us?
The one thing I want to say is robotics will never replace a surgeon.
Yeah.
It's going to enhance the surgeon.
Yeah.
It's going to make them better with better plans,
hmm
better results.
Yeah.
When I say better results, surgeons can do very well with what they currently do.
hmm
I'm talking about just the accuracy of putting in. It's precise.
Absolutely.
So with the AI, a lot of that information is coming out. If I would still like to, I still think a surgeon controls the room. They're the ones that are going to be doing it.
Yeah.
I don't trust AI, but
Yeah.
that's just me. We
Yeah.
just have a plan, and the surgeon. And when I say a plan, the surgeon, we take the information that the surgeon gives us.
Right.
We stay within his boundaries
Yeah.
or her boundaries.
Yeah.
So
All right. Well, how about you, Dr. Albana? Is there anything that you think is important to share about this procedure and the outcomes?
I do want to echo the fact that, I don't see anything in the foreseeable future where a surgeon is not in the room
Yeah. Yeah.
doing what
I hope
needs
not.
to be done
Gosh.
for a patient.
Yeah.
Right? The robot is only as powerful as the surgeon is.
Yeah.
So while my Mako team is awesome and they come to me with a plan, in the end of the day, I'm making the adjustments to that plan.
hmm
I'm making the appropriate measurements that need to be made, and we're pivoting if we need to pivot.
Yeah.
But you can't pivot if you don't know what you're pivoting away from. So the
Good.
information
That's
that you're
very well
getting
said.
from the robot is invaluable, in my opinion.
Yeah. I like that. That's pretty powerful for sure. Well, this has been a great conversation. Troy, it's nice for you to join us and share a little bit about how you collaborate with our physicians behind the scenes and the day of in the OR. I think it's very important. So thank you both for joining us.
Thank you.
It's nice to have you. If you'd like to learn more about robotic-assisted joint replacement, if you're having joint issues in general, you can call or text us at 856-690-1616 or visit poasnj.com to schedule an appointment. Thanks for listening to this episode, and please share if you like it. And as always, stay active and keep those joints moving.